Hi, my name is Dawn, and today I will be doing a head and neck assessment. I'm gonna go into a room and introduce myself to my patient. So I'm gonna go into a room, close the door, sanitize my hand. Good afternoon, sir. How are you doing today?
Good.
Okay, my name is Dawn, and I will be your nurse, and I will be doing the head and neck assessment on you. Can I have your name and your birthday, please?
Tony Dow, 1071.
Okay. So I have the right patient. I already explained to him that I'm going to do the neck and the head assessment on him. So the first thing for the head and neck assessment, I want to do the inspection on the head. I'm basically looking for the side of the head, the shape, the contour, making sure everything is symmetrically, equally, and consistent. So he have a normal head. Everything is symmetrically consistent. Um, Everything is normal. His head is round, midline, no lesion are visible. Um, he was able to have his head still upright with no involuntary movement. Um, the next thing I'm gonna do is I'm gonna inspect the coronary nerve 7, which I'm gonna ask the patient to do some facial expression for me. Sir, can you smile for me? Frown, raise your eyebrow, puff your cheek. He was able to do all of these, and it's shown that he had it's normal. His cranial nerve 7, the facial nerve, is normal. Um, the next thing I'm gonna do is I'm gonna palpate the scalp for surface character to make sure there's no bony protrusion or mass that can be felt. And by doing that, I'm gonna wash my hand and put on some gloves. So I'm gonna wash my hand, put on some gloves. So I'm gonna be palpating your head to see if there's any abnormal bone structure or mass on your scalp. Okay. So his temperature is warm. There's no bony um, protrudes that I can feel, no mass. While I palpate in the head, I'm gonna palpate for the temporal artery, and the temporal artery can be found on the tip of the ear between the eyes. Is there any tender when I do this?
No.
Okay. And then the next thing I'm gonna do is I'm gonna palpate for the TMJ. It's right here. I'm gonna ask him to open his mouth, close his mouth. I'm gonna look to see if there's any cryptation when he open it and close it. And then I'm gonna ask him to clean his teeth, grind his teeth. I'm gonna feel for the temporal and the mass, mass, messier muscle contraction, and basically that's the cranial nerve 5, the trigeminal motor nerve. And the next thing I'm gonna do is I'm gonna check his cranial nerve 5 for the sensation. So I'm gonna ask you to close your eye and tell me the location where I touch either with a dull object or a soft object, okay?
Soft left top forehead.
Okay.
Dull right cheek. Dull left cheek. Soft nose. Soft right chin. Soft right forehead.
Okay. So everything was good. Now I'm gonna go down and start inspecting his head. So I'm gonna ask him to slightly extend your head, your neck. So his triage is in the middle. There's no mass. Everything is symmetrically balanced. I'm gonna ask him to take a sip of water for me with extending your head. Okay, so I can see the triage move up and down when he swallow. And the I can see the thyroid collages and the cricoid collages move up were symmetrical as he swallow. I'm gonna ask him to flex his neck down a little bit to inspect his C7 in the back, and when he does that, I can also forward palpate it in the back, so you can leave your back normal. So the next thing I'm going to do is I'm going to inspect his next movement. Can you turn your head to the right for me, please? Now turn it to the left. Can you turn your chin toward the ceiling? And turn your chin toward your chest. Okay. So client had normal neck movement. He was able to rotate his neck from left to right. He was able to flex his neck and extend his neck. And the next thing I'm going to do is I'm going to check the cranial nerve 11 by asking him to stroke the shoulder against the resistance. Okay. And also, can you move the resistance? So good. And move again the resistance. Good. Okay. So the next thing I'm going to do is I'm going to try to palpate the tracheal ring. And we can do this by palpating the sternal knock and feel for the ring down here. And the first ring is the cricoid collages of the tracheal. Okay. And I can feel his tracheal. And in and the next thing we want to do is palpate for the thyroid collages or the thyroid gland. You can turn. You see, on the normal person, you will not be able to palpate any mass on the thyroid gland. You can only feel it if there's a mass on the gland, and then you can only feel it if it's a very extremely thin client. And if you do feel a thyroid mass on the thyroid gland, you want to listen to the thyroid mass with the bell of your stethoscope, and this is the abnormal finding, and is usually found in patients who are hyperthyroidism. Okay, so you can turn around for me, please. Okay, so the next thing that we're gonna do is we're going to palpate the lymph node, and the first lymph node that I'm gonna palpate is the preocular lymph. You can turn to me for a little bit, and it should be right here. It's in front of the ear. The postocular node can be palpated behind the ear. The ocular node can be palpated at the posterior base of the skull. The tonsillar node can be palpated right here at the edge, the angle of the mandula. The submandibular node can be palpated on the medial border of the mandula. And the submental node are palpated behind the tip of the mandula down here. The superficial clavial node are palpated in the superficial area to the sternomastoid muscle, which is right here. the posterior clavicle note or palpate in the posterior of the um, sternomastoid and the anterior of the trapezius posterior angle. Right here. The deep clavicle chain note palpate deeply around the sternomastoid muscle, and it's around here. And while I palpate his lymph node, I couldn't feel no mass or hard. It feels soft and round. So that's basically a normal finding, and that's conclude the assessment of the head and the neck.